by 11:30.
Okay, okay. I apologize. I
So
apologize.
may I
Yes,
continue,
Dr.
sir?
Banerjee, you are at the liberty of time.
We are
Not too much.
actually, I mean, it has become almost, it is I think, paap ho jata hai if you can want to find out any efficacy or any adverse events of the vaccine, if any. It is given that vaccine was safe. Question is, there have been reports of spike protein persisting. So very difficult. We have to have a long-term study of those who are vaccinated and those who have not taken the vaccine, who have had natural infection. There are many people who have had natural infection who did not take the vaccine, to tease out whether the effects are due to the spike protein of the vaccine or due to the virus, long COVID, who have not taken the vaccine. Until unless we have that, we are covering everything under one blanket. So we will not know any adverse event. Besides that, it is well established now, remdesivir had a lot of adverse events on the kidneys. Similarly with ventilator on the lungs. So these type of adverse events, the people may suffer from long-term chronic conditions, chronic kidney disease due to remdesivir, then chronic lung conditions due to the ventilator misuse. All this will be clubbed as long COVID. So it is a very messy thing. We have to first define what is long COVID, and we have to have a separate group who have not been exposed to remdesivir, who have not been exposed to ventilator, who have been not, but they have had COVID, not been exposed to vaccine. So we should plan a proper study. We have got a digital platform, and then only we should have a long-term database. We should have an adverse events reporting system, which is still not very good in our country, given the mass scale vaccination rollout. Only then we can comment scientifically. Otherwise, these are all speculations. So this is what I am deal with data, so I can only understand data. Thank you, sir.
Dr. Banerjee, one thing you can do at least with your expert thoughts, that what are the possible studies? I can request all my other colleagues also are required. I'm sure whatever we are talking must be in the mind of so many experts all over India. But if you can have a list of 1, 2, 3, 4, 5 and send it to us, and
Yes.
we all will try to persuade our own contacts, institutions to conduct at least some data. And of course, if there is a umbrella data that is ICMR and all, that is wonderful.
We
Thank you
should,
very much. I think we should.
data dividend is very, we have got a
At least
big,
India can give a big data.
yeah, yes, sir. Yeah.
Unfortunately, we are having big in numbers. So when we are big in numbers, there has to be big suffering. And literature, हम नहीं देंगे तो और कौन देगा?
So,
Am I correct, Dr. Mishra? हम लोग लिटरेचर नहीं देंगे तो कौन देगा?
Absolutely, sir. But it is a pity that so many studies were quoted by Sanjay, by Dr. Amitabh Banerjee, by others. There was no study from India. During acute phase, during post-COVID, it is incumbent upon our public health experts, the internal medicine people, and it's a laborsome. It's not easy to do this study where people who suffered, a lot of people did not suffer COVID. So one can easily get a cohort of individuals who did not have COVID and now how they are faring now, and those who had COVID, mild, moderate, severe,
Very
whatever.
good.
So I think that has to be done, but it can be ICMR led, it can be Dr. Rai led study, but it's a laborsome study. It's not easy to conduct, even if the data is available.